Today we are going to understand infectious canine hepatitis. This is a viral disease of dogs caused by canine adenovirus type 1. It occurs worldwide and mainly affects young dogs, although other wild carnivores like foxes, wolves, and bears can also be infected. The severity of this disease can vary a lot. Some dogs may only develop a mild fever, while others can become severely ill or even die suddenly. The virus mainly damages the liver and blood vessels. Because of this, many of the signs we see are related to liver injury and problems with blood clotting. Let's first understand how the infection spreads. The virus enters the body through the mouth or nose, usually from contact with infected urine, feces, or saliva. It can also spread through contaminated objects or parasites. After infection, the virus first multiplies in the tonsils and nearby lymph nodes, then enters the bloodstream and spreads throughout the body. It mainly targets the cells lining blood vessels, and also affects the liver, kidneys, spleen, and lungs. Even after recovery, dogs can shed the virus in their urine for up to 6 months. The incubation period is about 4 to 9 days. Clinically, the first sign is usually a high fever above 40 degrees Celsius, often biphasic. Other signs include lethargy, anorexia, and polydipsia. You may also see conjunctivitis, serous oculonasal discharge, and corneal clouding, also called blue eye. Dogs may show abdominal pain, vomiting, and hematemesis. Clotting time increases with disease severity. Due to coagulopathy and vasculitis, petechiae may appear in the oral mucosa. Severe cases may progress to disseminated intravascular coagulation with uncontrolled bleeding. Some dogs develop enlarged tonsils, tachycardia, and subcutaneous edema, especially in the head, neck, and trunk. Interestingly, even though the liver is affected, icterus is usually absent in acute cases. In rare cases, the central nervous system is involved. This may be due to hepatic encephalopathy or intracranial hemorrhage. Dogs may show seizures, paresis, ataxia, or central blindness. Laboratory findings include prolonged prothrombin time, thrombocytopenia, and increased fibrin degradation products. Liver enzymes like ALT and AST are elevated, showing hepatocellular injury. Proteinuria is also common. During recovery, dogs start eating but regain weight slowly. Liver enzymes peak around day 14 and then decrease. About 25% of dogs develop bilateral corneal opacity 7 to 10 days after recovery, which usually resolves on its own. On post-mortem examination, there are characteristic lesions. Endothelial damage causes paintbrush hemorrhages on organs like the stomach, lymph nodes, and pancreas. The liver shows necrosis and color changes. The gallbladder wall is often edematous. Diagnosis is based on clinical signs and laboratory tests. Tests like ELISA, serology, and PCR are used. PCR is especially important to differentiate canine adenovirus type 1 from canine adenovirus type 2. There is no specific antiviral treatment, so therapy is mainly supportive. This includes fluid therapy, proper nutrition, and management of coagulopathy using plasma or blood transfusions. Antibiotics are given to prevent secondary bacterial infections. Corneal clouding usually resolves without treatment, but atropine eye ointment can reduce pain. Dogs should be protected from bright light. Corticosteroids are contraindicated in this condition. Prevention is very important. Vaccination provides effective protection. Although the disease is caused by canine adenovirus type 1, vaccines use modified live canine adenovirus type 2, which gives cross-protection, protects against related virus, and is safer. Puppies should start first vaccination at 6 weeks of age. Then boosters are given. First dose at 9 to 11 weeks, second dose at 12 to 14 weeks and last third dose at 16 to 17 weeks of age. After the initial series, protection usually lasts 3 years or more. In summary, infectious canine hepatitis is a serious viral disease affecting the liver and blood vessels. Understanding the pathogenesis, disease development, recognizing clinical signs, and ensuring proper vaccination are key to controlling this disease. Thanks for watching VetCare. If you found this helpful, don't forget to like, share, and subscribe for more simple and clear veterinary lessons.